Hi, my name is Barb Drapola, and I'm here to talk with you today about the MedEx program. I'm the Director of Care Coordination at Crouse, and myself and a team of others have been working on reducing readmissions here at Crouse Hospital. And one of the programs that we've implemented has been the MedEx program. It's a partnership between Patient Portal and Rite Aid Pharmacy and Crouse Hospital, and the intention is to bring discharge medications directly to the patient at their bedside before they leave the hospital. In our efforts to reduce readmissions at Crouse Hospital, we learned right away that one of the things that we needed to do was reach out beyond the four walls of the hospital and work with our community to help improve patient care outside of the hospital. And immediately we knew that helping patients become more adherent with their prescription medication regime post-hospitalization was a really important effort in reducing readmissions. After we surveyed our patients, we learned right away that some of the barriers that prevented patients from being adherent with their medication program were as simple as not having transportation to get to the pharmacy, not feeling well enough to stop at the pharmacy on their way home from the hospital, and also encountering problems with insurance pre-authorization, co-pays, co-insurance, those sorts of things that prevent patients from simply filling their prescriptions when they leave. The MedEx program allows us to ensure that the patient has their 30-day supply of medicines before they leave the hospital, which is a great convenience for the patient because the delivery is free, and it's a big comfort to the providers to know that that patient has a 30-day supply when they leave the hospital. As a part of the MedEx program, prescription medication counseling is offered by the Rite Aid Pharmacy so that if the patient at the bedside has any questions or concerns about their medicines, that counseling is offered right there, and they can receive that either remotely or they can receive it by telephone, or even if necessary, a pharmacist can come to the bedside and speak with the patient and answer any questions that they have. All of the barriers that the patients have experienced at the pharmacy do become known to us at the hospital now through this program, so that we can help the patients work through any pre-authorization problems or concerns, and we can help them understand their co-insurance and co-pay so that they understand what that's going to be before the medicines are delivered. And one thing I do want to point out is that we have not experienced a delay in our discharge timeliness as a result of the program. In fact, for the most part, the prescriptions are delivered within an hour or slightly after an hour of prescription transmission to the pharmacy. And so by the time the discharge instructions are all complete and all the other components of the discharge are done, the delivery has happened, and it has been more than an hour actually before the patient leaves. Overall, MedEx has been a great program. We're super excited about it. It has helped us reduce our readmission rate in the MedEx group by about 15%. It's provided a great convenience to our patients, and patient satisfaction has been tremendous. We've been measuring patient satisfaction with the program since we began over a year ago, and the rates have been in the high 90s ever since we initiated the program. And now that we've had a year or so experience with it, we're actually seeing repeat customers come back and request the MedEx program.